Thanks so much for taking a few minutes to join me now. I'm Paul Heller, and I have the privilege of chairing the board of Mindful Philanthropy. And I want to talk just for a few minutes about first how I found myself being involved in this field, my why. Second, and very importantly, a bit about the work we're doing at Mindful Philanthropy and what led to that. And then last, I'd like to ask for your consideration for support. So first, like so many of you, you're probably listening to this and you're connected deeply and personally to some issue around mental health and addiction. And I am. We lost our beautiful son, John, 5 years ago. And he was challenged with mental health and with addiction and with pain. Unfortunately, John was in a terrible car accident at age 17. Every parent's worst nightmare. There was a knock on our door. It was a policeman who was telling us our son was being helicoptered to a trauma center. And we didn't know much more than that until we arrived. That really began a 6-year journey for us with John. And he had half a dozen surgeries in the ensuing years. He was just an amazing young person who would light up a room and had such great courage and such great energy and positivity. But he lived with chronic pain, which ultimately led to addiction. And he was also challenged with mental health issues. Ultimately, that trifecta was just too much to overcome. And he passed away at the young age of 23. So that was a real catalyst for our family to become more deeply involved. I had a career at Vanguard. I had just retired after 30 years there. I joined University of Pennsylvania. They have a group called the Center for High Impact Philanthropy. And I helped with an effort where we really did deep research around philanthropy in this field. What if you want to help? How would you do it? What are the opportunities? What's worked well? What hasn't worked well? We were very proud of that work. You can see it online. It's called Health in Mind. And we actually got to present that at Congress before COVID hit. And it was a real eye-opener for me, especially in that it showed there are so many opportunities out there to help. We know what to do, yet such a gap that exists because very little funding was going into high-impact opportunities. Americans are so generous, yet most of the funding goes to other categories, whether it's physical health issues or religion or the arts and sciences. It's not going to mental health and addiction, and we wanted to get at that gap. And that was really the idea for funding Mindful Philanthropy. We've been up and running for a year, and we are helping donors and foundations identify high impact opportunities in the areas that they care about, funding those. And there's often, we're finding adjacencies. People care deeply about, might be kids growing up in a low income neighborhood. It might be women and girls. It might be income sufficiency in low income neighborhoods. There's a host of issues. And what we found is for those groups to achieve better outcomes, if they're investing in opportunities within mental health and addiction, they in fact get better outcomes in their space. So we set out, we talk to people, we talk to foundations, we research high impact opportunities, and we try to galvanize funding into the sector. We had a really good first year. We have generous support. We have a great board of directors, and we have an absolutely terrific team at Mindful. We are gearing up for year 2 opportunities. We are excited. We are confident we will make progress. We invite you to join us. It is a leveraged investment. Help us mind the gap. There is too big a gap between opportunities that are so wonderful and the suffering that's taking place and the issues that people are grappling with. So I ask you for your support. Please consider joining this year's campaign. Thank you so much for listening.